I would like to discuss briefly about the treatment modalities for subfertility. But before I go to elaborate on the treatment modalities, we must reassure couples that they must not suffer in silence. There is help at hand. So the main thing is to recognize that there is a problem and go and see a subfertility specialist who will be able to help you. When a couple comes to us, it is very important to first do a comprehensive history taking and investigations before we decide on the treatment modalities. If not, a lot of time and money will be spent on unnecessary treatments. We must bear in mind that subfertility is not only a woman's problem, it is a man's problem as well. So 1/3 of the time it's a problem related to the female partner. 1/3 of the time it's a problem related to the male partner, and 1/3 of the time it's a combination or an unknown factor. So we need to do a few tests for both the female partner and the male partner for us to have a rough idea as to what's going on. So with the female partner, what we would do is we would do a baseline ultrasound scan to see whether the reproductive organs are intact and if she is producing eggs, some hormone tests, and then HSG or something like that, ascertain whether the fallopian tubes are working in order. And then for the male partner, the main test that we can do is a basic semen analysis. That would tell us about the quantity and the quality of the sperm. So depending on what the results of the investigation is, then we will go on and plan a treatment for them. So it can be just something as simple as basic counseling the patient. For example, enlightening them as to when their most fertile period is and around how many times or what periods they need to try if they were to conceive a baby. So simple things like that. By counseling the patient, sometimes we are able to help them. Or else we can use simple methods like induction of ovulation, so that we just do follicle tracking and then we can see when a follicle matures, and then around that time we can advise the couple to have normal intercourse. Of course, for these things to happen, all the basic investigations need to be normal. If, for example, some men are having slightly lower sperm counts, then we can do what is called IUI or intrauterine insemination. So that's also a treatment option. And if all these fail, or if there is a clear problem where we can't do the basic treatments, then we will have to go for ART or assisted reproductive techniques.